myself, Dr. Manisha, Assistant Professor, Candidate Physiotherapy Department in RPIIT Technical and Medical Science. Welcome to our YouTube channel, RPIIT Academics. If you like the content of this channel, please like, share, and subscribe. Today's discuss about the hysterectomy introduction. The surgical removal of the uterus, very common procedure. Classification. Now we can see the diagram of uterus, subtotal, total, radical. This is the subtypes of hysterectomy. It can be classified by the amount of tissue resected. Total hysterectomy, subtotal hysterectomy, radical hysterectomy. Removal of the uterus and cervix. Subtotal hysterectomy, removal of the body of the uterus only, leaving the cervix behind. Radical hysterectomy, removal of the uterus and cervix, the parametrium or vaginal cuff and part of the whole of the fallopian tubes. The procedure is carried out in selected cases of the cervical cancer. The ovaries may be removed or may be left behind depending on the patient's age. Total hysterectomy and bilateral salpingo-oophorectomy, removal of the uterus, cervix, fallopian tubes, and ovaries. Procedure. There are three main approaches to hysterectomy. The principles and steps for each approaches to a hysterectomy. The principles and steps for each approach are the same, but in a different order. Abdominal. It means incision in the abdomen. Vaginal. It means incision through the superior part of the vagina. Laparoscopic. Why small incision in the abdomen using laparoscopes and uterine manipulator. Mobilizations should be encouraged as soon as possible. Discharge is usually after 1 to 2 days for vaginal and laparoscopic hysterectomy and 2 to 5 days for abdominal hysterectomy depending on the type of incision. Generally longer stay if midline incision. Now we can see the abdominal incision in uterus. Low transverse incision, this is also called the bikini line, and the last one is vertical incision.